As an avid soccer player, I've seen injuries come about in nearly every game I've played. Whether it be me or my teammates, some injuries are minor and recover within a day or two. However, some injuries could be a little bit more severe and can take up to a few weeks. Critical or more severe injuries on the field are more dangerous and they can't be prevented as easily. One major example of this type of injury is an ACL tear. ACL stands for anterior cruciate ligament. It's one of the strong bands of tissue that help connect the bone in your thigh, your femur, to the bone in your shin, your tibia. It is a vital ligament in your knee because it stabilizes your knee joint by preventing excessive forward movements of the tibia, and it limits rotational knee movements. Basically, it just keeps the tibia in place from sliding out in front of the femur, and it keeps your leg nice and held together. ACL injuries most commonly occur in sports that involve immediate stops or changes in direction, like jumping and landing without warning. The ACL tear occurs when that sharp or sudden movement forces the knee joint to succumb to a mass amount of force. This force pressures that ligament to move in the wrong direction, ripping it apart. In this case, the ligament isn't strong enough to keep the bones in the joints together and the ACL is pulled apart.
Just like how your bones break like candy canes, think of your ligament as a sort of rubber band. Sprains happen when the ligament is loose and tears happen when it's forced apart. If you stretch your rubber band out too much, it becomes weaker until it snaps.
When you go down from the impact, you'll feel a variety of symptoms relating to an ACL tear. A loud pop or popping sensation in your knee with severe pain comes immediately. Then, the inability to continue your activity, followed by rapid swelling and loss of range of motion, are the next things you notice. Once you get up, you'll have a lot of trouble bearing weight on that leg, or you won't be able to at all. As soon as you go to the doctor, they'll try and diagnose you by running a series of tests. Once they feel around your knee and feel how swollen it is, they can determine whether to use an MRI, ultrasound, or both. This exam allows them to figure out what's going on inside your knee. Finally, when your injury is confirmed, the doctors will give you a plan for recovery. If you're not an athlete or if your sport doesn't use sharp knee movements, surgery isn't usually recommended. You can mostly heal your knee through physical therapy, but you won't regain full function. When the ACL tears, the ligament can't be repaired on its own. In order to regain full function of your knee, the doctors will have to go in surgically and repair the ligament with a graft. The graft in place has to grow a whole new blood supply, and it can take a while. Ligaments and tendons have a very little blood supply compared to other parts of the body. This is why the blood flowing to the graft takes longer than it should and increases the time to treat the injury and restore the ligament to full health. With the addition of knee rehabilitation and physical therapy to get you back in shape, the whole process can take about 9 to 12 months. Although they're rarer than most injuries, they can definitely be the most devastating. Athletes know that they can't get a year back of training very quickly, and this can affect their mentality towards the situation and how they approach it. By changing the way blood is directed in the body, we can target ligaments and tendons to receive more blood and restore blood flow. As a biomedical engineer, I want to be able to find a way to target how blood flows into these areas so we can help victims of this life-changing injury.